When it comes to pain relievers, acetaminophen is a good one. It's been around since the 50s and is safe when it's used correctly. Did you know there's a right way to use acetaminophen? According to the Food and Drug Administration, acetaminophen is in more than 600 over-the-counter and prescription medications, including antacids, cold and flu medications. It's also an ingredient in prescription drugs like Vicodin and Percocet. So why is there so much concern about acetaminophen? It's processed through the liver, and an overdose could cause liver failure. And taking the maximum daily dose for long periods of time could cause liver damage as well. The FDA recommends that an adult take no more than 4,000 milligrams in a 24-hour period. But even that could be too much for some people. Children can take acetaminophen, but read labels carefully. Doses are usually determined by a child's age and, more importantly, weight. When using acetaminophen, be careful to look at the labels for all the medicines you are taking. Since it's in so many medications, it can be easy to take too much. When you're looking, know that acetaminophen could also be listed under other names. What do you need to remember? Acetaminophen, whatever it's called, can be a very effective pain reliever as long as you know how much to take.